I guess it's a question many people have been asking in recent days. Why did the New South Wales Premier not act sooner in implementing a lockdown?
Well, good morning. I'm as a member of the Crisis Committee, we make these decisions based on the information in front of us. We make it on the advice of our health experts, Dr. Kerry Chan and her team. One of the things that we've been applauded for over the past 18 months is that we've taken a steady, calm approach, no knee-jerk reaction to decisions in managing and coming out of COVID. And this week we took that very managed, calm approach. And what we're seeing is that the numbers are not in decline. There's no escalation, but they are constant big numbers, or, in my mind, they're decent-sized numbers that are consistent, and therefore we've got to take the next step. Now, if you think about the restrictions we announced on Friday, they were severe, but when we started seeing some new hotspots outside of those 4 LGAs, and on the advice of the health experts, we made the rash decision, we made the appropriate decision that yesterday we had to go into lockdown.
And have you got a sense of what the number will be today? Will it be larger?
No, my sense was it'll be similar to what it was yesterday and the day before. And this is what we thought would happen, that the numbers would be consistent. But what the issue is that the numbers, even though consistent on larger tests, is that they're coming from other parts of the city. And that's why it's important now that we lock down the whole city. And that's why we make this decision, 14-day lockdown, or it's really a 13-day lockdown. But, this has the full support of the Crisis Committee. You know yourself, I'm one that normally wouldn't go down the lockdown path. But in this case, and over the last 48 hours, I've been quite strong on it.
So no dramatic escalation today, which is good news, Deputy Premier. In that context, are you confident that this 2-week lockdown will be enough to keep a lid on it?
Absolutely. I mean, we tossed and discussed if a 7-day lockdown was sufficient, but we all know that it takes 14 days to go through the system to be genuinely 100% sure. This is about getting back to zero community transmission. And a 14-day turnaround is what you do require. So, I'm confident that over the 14 days, this would be eliminated in a way. But the Premier has left open, and she said yesterday in her press conference, that we will revisit this at the 7-day mark. If things improve dramatically over the next 7 days, of course there's an opportunity to revisit. But, we want to be honest with the public. That's why we said it's going to be a 2-week lockdown. You might as well prepare for a 2-week lockdown, and if anything better than that happens, well, that's a bonus.
John Barilaro, was the Premier and the state government under pressure from the Prime Minister and the federal government to keep open, to try and stay open in the face of the rising cases?
I can tell you, hand on heart, there's been not a single word uttered in relation to the Prime Minister or the federal government being involved in any of these conversations. As I said, I've been a long-standing member of the Crisis Committee meeting. At no point the question about what the feds wanted was ever discussed. There was no pressure, as far as I know, and we made this decision based on what was right for the people of New South Wales, being careful and calm during the week. But we realised by the weekend it was time to go down the full lockdown path.
Is there a perception that the Premier wants to retain her reputation as the Premier who keeps business open? Is that part of the thinking?
Have a think about it. We've kept the business open as long as it's possible. We've opened before anyone else. We've lifted restrictions before anyone else. That reputation is there for both the Premier and the government, and we're proud of that. As myself, the Treasurer, Minister Ayres, Minister Dominello, Minister Hazzard have been part of this crisis committee, especially on the lifting the restrictions. That we're proud of the work we've done there, supporting the Premier. It's a team effort, and we have kept businesses open. But we know that if the best thing for business is certainty, and the best thing for the public is certainty, you're better off going down to a sharp 2-week lockdown than having this slow death by 1,000 cuts of restriction after restriction after restriction. And on the data that we've seen, we've made a decision to do this. And I know a lot of industry leaders who we've been in touch with would rather a 2-week lockdown than, as I said, a slow death of 1,000 cuts.
Is New South Wales paying the price of the slow vaccination rollout federally?
I don't think you can just blame the federal government. Yes, there's issues with the rollout, but we've had supplies and we've had stocks of the vaccine. I think we're a victim of our own success for far too long, and for a very long period of time. We've had zero community transmission, zero cases right throughout, and whenever we've had a couple of cases, we've been able to nip them in the butt straight away. And therefore, I think there's been a level of complacency in the community in relation to getting the vaccine, especially when there's been a lot of debate about AstraZeneca, if it's safe or not safe, and the changes and some of the narrative from the federal government around AstraZeneca probably hasn't helped. And I think this outbreak and the outbreak in Victoria has probably reminded people
What sort of thing are you talking about on that? The narrative.
Well, we've heard mixed messages. I know that federally the mixed messages initially was, get vaccinated, but if you're not sure, take your time. You can't say that. In my mind, is everybody must get vaccinated. The most vulnerable, the general public, all those that are eligible to be vaccinated need to be vaccinated. And this outbreak.
Are you open to the idea? Are you open to the idea of letting everyone have access to AstraZeneca if they're willing to sign a waiver? Say everyone over 18 that wants it can have it, because we know the risks are minuscule. If someone wants to be vaccinated and they're willing to sign a waiver, are you open to offering it to everyone?
Well, that's above my pay scale. I'm a humble chippy from Queensland that became a politician and is now the Deputy Premier. But I seek to surround myself with experts, and the advice from those health experts is that they're rather being cautious. But look, I think there's merit in what you said. I'm a pragmatic person. We've got a large supply of AstraZeneca in Australia, and people are prepared to get vaccinated and are prepared to waiver away those legal obligations. And maybe that is an opportunity if it means more people will be vaccinated quicker. But at the same time, the federal government has confirmed and committed to increasing supply of Pfizer and some other alternates. So in reality, that would be something if it was of last resort. But I don't think we're there. We're at a point of last resort. I just think people need to line up, get the jab, and get vaccinated. I think that's the most important part of this. Is that I think the waiting to see what it looks like is come and gone. Now, this is a stark reminder why the general public must get vaccinated.
In hindsight, should the federal government have spread its bets more? Should it have spread the bets more in terms of which vaccines it acquired?
In hindsight, there are a lot of things we could have done differently. We could have managed Ruby Princess differently. We could have mandated the mask on that limousine driver. I mean, the reality here is, I'm not going to blame the feds. There's been no playbook or rulebook over the past 18 months how to manage this global pandemic. We've done well, sometimes by luck and chance, but sometimes some of the failures within the processes. But every mistake you learn from, and that's why we've become what we've become in New South Wales, and we're proud of that. I'm not here to blame the feds. No, I think the feds at the time put its bet on those two particular vaccines, the Pfizer and AstraZeneca, because globally that's what was being used. It was safe, continues to be safe, and now there's other options in front of them, and they should take those options, because this is about getting the general population vaccinated. Well, it's good to have other options on the table.
You were at that dinner that Andrew Clennell reported on at the New South Wales Parliament. Why are you isolating and not Mr Hazzard, Mr Perrottet or the Premier?
Well, yes, I was at that dinner, and Mr Hazzard, Mr Perrottet and the Premier were at that dinner as well. They came in for anywhere between 15 to 25 minutes. They spoke, they didn't mingle, they didn't sit there for the dinner. I was there for a couple of hours. I didn't actually mingle or actually get close to Adam Marshall at the dinner. I was at the other side of the room. I've been deemed a close contact, not because of that incident at the dinner, but because of the incident that I actually met. Adam Marshall had come to my office, to my general office, at about 5:30. He was there between 5 and 10 minutes. I had an interaction with him for about 1 or 2 minutes, or could be 3 minutes, about a couple of metres apart or a bit more. But that in itself has deemed me a close contact. That's the reason I'm in isolation.
What about Dominic Perrottet? Adam Marshall patted him on the back, basically spoke to him into his ear. That sounds pretty similar to what you had, but probably even closer contact.
Yeah, look, I've asked that very question because, I don't want to be in 14 days lockdown. This is tough. I'm stuck in an apartment in Sydney. But the reality is, mate, a lot of us have to go through this. And the reason, my understanding is, it didn't meet the threshold. They put a time threshold, that the interaction has to be more than a minute or 2 or 3. In the past, it used to be 15 minutes. It's down to just in the sense of a minute or 2 now. And I breached that threshold in that circumstance, just watching that video there. Yes, there was an interaction, there was a pat on the back, but it was what are you talking, 3 or 4 seconds? And the reality there is that's why he's been deemed not a close contact, and that's because of the experts. And we've got some of the best contact tracers who've been doing this for 18 months. So I'll trust what they have to say and why they deem someone close and someone casual. But they're always reassessing. We saw that yesterday with other ministers who were casual contacts, now close contacts, and there's been some close contacts that have been reversed the other way when they dig deep into the detail. I've been interviewed now twice, and here I am, close contact, in lockup.
Yeah, indeed. Just quickly before you go, the Premier's comments that she wanted clear air for the budget. She was going to do the news conference because she had to earlier in the week. Did she get the gravity of what she was and the government were facing from the outset?
Look, we've got a Premier that has got this gravity and has got the gravity of the pandemic more than probably any other person in the country, and I support her. When we look back over the 18 months, there were people like myself and the Treasurer and Stuart Ayres that were pushing to lift restrictions. We were probably not as hard as the Premier, so you can't ever think that the Premier was going to make a casual approach because of the budget. Regardless if the budget had clear air on Tuesday or Wednesday or Thursday, the reality is we look at the data. And today, no one's talking budget, everyone's talking about lockdown, so it's irrelevant. Absolutely not. The Premier has always been steadfast in making the right decisions, regardless of politics, regardless of pressures, based on the information delivered to us by the experts, and that's what we did yesterday.
Deputy Premier John Barilaro, thanks. I very much appreciate you joining us early this Sunday.
Thank you very much.